Fatty liver disease means that fat is inside the liver and over time it can affect liver function and cause liver injury. Persons who drink too much alcohol may also have fat in their liver, but that condition is different from fatty liver disease. Fatty liver disease is of two types. If there is just fat and no damage to the liver, it is called non-alcoholic fatty liver disease, NAFLD. If there is fat in liver plus signs of inflammation and liver damage, the disease is called non-alcoholic steatohepatitis, NASH. It usually doesn't cause any symptoms and is often detected by accident when an imaging study like ultrasonogram, CT scan or MRI is done for another reason. A fatty liver may also be identified on an imaging test as a part of investigating abnormal liver blood test. Fatty liver disease is sometimes called a silent liver disease. This is because it can happen without causing any symptoms. Many people with non-alcoholic fatty liver disease live with fat in their liver without developing liver damage. A few people will develop non-alcoholic steatohepatitis. If non-alcoholic steatohepatitis develops, they may have symptoms that can take years to develop. If liver damage from NASH results, it will lead to permanent scarring and hardening of liver called cirrhosis. Symptoms of non-alcoholic steatohepatitis include severe tiredness, weakness, weight loss, yellowing of the skin or eyes, spider-like blood vessels on the skin, long-lasting itching. Non-alcoholic steatohepatitis that turns into cirrhosis can cause symptoms like fluid retention, internal bleeding, muscle wasting, and confusion. People with cirrhosis over time may develop liver failure and will need a liver transplant. The risk factors of non-alcoholic fatty liver disease include overweight, high blood fat levels, having diabetes or prediabetes, having high blood pressure. Treatment. If there is non-alcoholic fatty liver disease only without any other medical problem, we need not have any special treatment, but making lifestyle changes will control or reverse the fat buildup in the liver. So, the lifestyle changes are losing weight, lowering cholesterols, controlling diabetes, and avoiding alcohol. If you have non-alcoholic steatohepatitis, no medication can reverse the fat buildup in the liver. In some cases, the liver damage will stop and even reverse by itself. But in others, the disease may continue to progress. So, if there is non-alcoholic steatohepatitis, it is important to control any condition that may contribute to fatty liver disease. Treatment and lifestyle includes 1. Losing weight, medicines to reduce the cholesterol level, medicines to control blood pressure, diabetic medication, limiting over-the-counter drugs, avoiding alcohol, and consultation with an liver specialist. Certain medicines are being studied as possible treatments for non-alcoholic steatohepatitis. They include antioxidants like vitamin E. Diabetic medications will be given if there is diabetes. Anyway, medication should be taken only after consultation with a liver specialist. Complications. The main complication of fatty liver disease is progression to non-alcoholic steatohepatitis and then to cirrhosis. Cirrhosis means permanent scarring and hardening of the liver. So, steps to keep the liver healthy. The important things taken into consideration are: do not drink too much alcohol. Too much is controversial, but it is probably best to avoid alcohol completely. Second, make sure that medications, herbs, and supplements taken are not toxic to the liver. Even acetaminophen or certain cold medications may be harmful if taken too much for too long period, especially if you have liver disease or drink heavy alcohol. Third, get vaccinated to protect against liver viruses like hepatitis A and hepatitis B. Control other health conditions like diabetes, hypertension, and dyslipidemia. Fifth, get regular screening test for liver cancer if already cirrhosis has developed. The most effective fatty liver treatment are the lifestyle changes. The good news is that fatty liver disease does not involve medication but lifestyle change. The bad news is that these lifestyle changes are typically hard to achieve and maintain as such for many people. So, weight loss. Weight loss of roughly 5% of your body weight might be enough to improve abnormal liver test and decrease the fat in the liver. Losing between 7% and 10% of the body weight decreases the amount of inflammation and injury to liver cells, and it may even reverse some of the damage of fibrosis. So, target a gradual weight loss over a period of weeks, as if very rapid weight loss is achieved, it may worsen inflammation and fibrosis. Aerobic exercise leads to decreased fat in the liver, and with vigorous aerobic exercise may possibly lead to decreased inflammation. The eating plan compromises and it emphasizes on fruits, vegetables, whole grains, legumes, nuts, replacing butter with olive oil, and limiting red meat and eating more fish and lean poultry. Drinking coffee, perhaps 2 cups per day, has a decreased risk in fibrosis. Kindly subscribe for more videos.